a medical doctor and the leader in scientific education in Armenia. So, what inspired you to work in harm reduction?
So, especially tobacco harm reduction, my inspiration was the fact that almost half of the male population in Armenia is smoking. So that's a huge problem. And when looking into what methods are people using to try to solve that problem, obviously in Armenia, whatever they're using, it wasn't working because still half of the male population was smoking. And after I looked into alternatives of what can be done, I learned about tobacco harm reduction. And then life gave me the opportunity of the scholarship, and I ended up here.
Okay, so what message did you share with the participants during your presentation at this year's GFN conference?
So some of the points were, first of all, that Armenian healthcare, me being a doctor, I really focus on healthcare system as well, that I did a research last year which showed that over 80% of Armenian doctors have never received any training on how to fight smoking. And the focus to me is that education is key. I feel like you cannot fight something that you don't know about. So if we don't know what causes, what substances in cigarettes cause issues, how do we fight them? And the misconception about different methods and the misconception about the what's contained in cigarettes is so broad in Armenia that it's clearly evident that the lack of knowledge is one of the main points which is leading to such percentages of smokers there.
So, as you mentioned, education is the most important in THR. Why?
Going back to the same sentence, you cannot fight something that you don't know how to fight it. I feel like most of the misconception about THR comes from the fact that people don't know what it is. For example, before studying THR, I also had the view that all alternative nicotine products are much worse than cigarettes. Then I started to learn about different aspects of each product, and I'm like, okay, wait, tar is the thing that's killing people, nicotine isn't, so this makes sense. So just reading and reading independently, reading independent journals, reading high quality researches is what convinced me that tobacco harm reduction actually works. And adding the fact that, for example, Sweden is winning in those terms, like 40% less cancer rates, Japan, UK, etc. Reading has easily convinced me, so why wouldn't it convince others, especially doctors, because doctors should be people driven by evidence-based knowledge. So,
how do young people in Armenia feel about safer nicotine products?
it is very divided. So around maybe 2 or 3 years ago, there was this wave of these products being very modern, very stylish. But then some time passed and a lot of people started to go back to combustible cigarettes, and a lot of them stating that, because in these products are some chemicals that we don't know what they are, so we better go back to stuff that we know. But every now and then you, of course, can see young people using the alternative products, but the views are very divided, and I would not be able to state that, they're pro, they don't like it, so it's very, very divided.
Now, this year's strapline is Challenging Perception, Effective Communications for Tobacco Harm Reduction. So what are the biggest barriers to communicating about THR in Armenia?
To me, the biggest barrier is the already very rooted misinformation. Whenever I try to have a short conversation about THR and try to explain how alternative products are less harmful than cigarettes, I immediately have this backlash of, no, they are much worse. And yeah, but once I go step by well, I'm organizing trainings in Armenia for about the methods of fighting against smoking, and once I'm going step by step about different methods, about all the details, that's the way that I'm seeing works for people, and they're like, okay, maybe there's something right about this. But once you just mention that THR works, the first reaction that you receive is no, it doesn't. It much worse. So it's very very rooted, and that lack of knowledge and evidence of the misinformation is the biggest barrier for me that we're trying to overcome with my team.